These children and many more owe their lives to Lao Friends Hospital for Children, the first paediatric hospital in northern Laos, the only 100% private paediatric hospital in Laos, and the only free hospital in the country. How did a US non-profit build and sustain a free, privately run paediatric hospital in northern Laos? It was a true collaborative effort. It all began with Khenro Izu, an acclaimed photographer who was photographing the Angkor Wat temples when he noticed many children were maimed and sickly. And he went to the local provincial hospital to find out why. While there, he witnessed a life-changing event.
That became my life-changing story, actually. It's a big hospital. Only one bed was occupied by a girl, and then sitting next to her was a man, so the father and the daughters. They traveled quite far away, but by surprise, that the doctor requested money, it's $2, to give a medicine treatment, and he said he didn't have money. Then hospital provided a bed. That's it. No medicine, no nothing, and girl lost her life. First I saw the family, father and the daughter seems to be similar age to my own daughters. Immediately I reflected on me how the father would feel when his daughter is so ill but couldn't help anything. I think that's the most painful things that for parents, not being able to do anything when she was a critical condition.
After witnessing this, he jumped into action and started a non-profit, Friends Without a Border, who immediately got to work building Angkor Hospital for Children, which opened in 1999 and has served over 2 million children to date. Friends Without a Border ran it for 15 years before looking for their next project. In 2015, Khenro and Friends Without a Border opened Lao Friends Hospital for Children in Luang Prabang in northern Laos. At that time, there was not a single paediatric facility, and the region had the highest child mortality rate in Southeast Asia. This was the place that needed us. For a small organisation to take on an endeavour like this, they need strong leadership, partners and friends. First, we needed permission and guidance from the Provincial Health Department and the Ministry of Health. They have been excellent partners for 12 years. Second, we needed strong governance from our board of directors, who all play a vital role in Lao Friends Hospital for Children. Third, we needed money. LFHC has been blessed with a strong family of donors from all over the world who provide grants, attend events, and supply in-kind donations. Fourth, we are hugely indebted to the invaluable group of global expats, both volunteers and paid, who trained our dedicated Lao staff, from leadership to laboratory skills. Expats taught and modelled providing high-quality, compassionate care. The result of these collaborations is the Lao Friends Hospital for Children in 2025. Like in Cambodia, the idea that no parent should ever have to watch their child die because they can't afford to save their life is still very much at the root of what we do, as well as our foundational cornerstones of compassionate quality care, training and prevention. However, from the beginning, we customised care and priorities to accommodate the needs of the children of northern Laos. Since its opening, the Lao Friends Hospital for Children has served 293,960 children. In 2024 alone, with a growing patient base, LFHC treated over 44,000 patients. This remarkable achievement has been made possible by the dedication of 218 staff members. We operate 12 departments staffed by highly trained and qualified Lao professionals. The outpatient department. The inpatient department. The emergency department. The surgical theatre. The laboratory. Outreach. Nutrition, and the polyclinic, nephrology, epilepsy and orthopaedic. The thalassemia clinic. This unique clinic follows over 500 children affected by inherited blood disorders that disturb the body's ability to produce hemoglobin. And the development clinic serves children with developmental issues such as Down syndrome, cerebral palsy and autism, creating a world where all children thrive. Lao Friends Hospital for Children has become the unofficial centre of excellence in these three areas: neonatology, critical care and malnutrition. We'd like to tell you more about these departments. This is Ernoi Bualoy. He was born with his intestines outside his body. This life-threatening condition is called gastroschisis. Bualoy's condition was severe and his family didn't know if he would survive. He received treatment in our NICU for over a month. Lao Friends Hospital for Children is the #1 provider of gastroschisis care in Laos. Bualoy is now a healthy, happy young boy with a bright future ahead of him, and his story of recovery would not have been possible without LFHC. The Intensive Care Unit.
Hello everyone, my name is Dr. Ann Kam. Welcome to our intensive care unit. We are the only ICU in northern Laos providing free treatment. We have very sick children fighting for their life. Our staff are working hard to give the best care they need. Without this ICU, many of the children may not have chance to survive. So help us to complete our mission. Thank you so much for your kind support.
Over the past 10 years, the LFHC has become an expert hospital for treatment of malnutrition and providing education for hospitals, village health centres and directly to families.
In September of 2022, our hospital met with UNICEF and the Ministry of Health in Vientiane, the capital of Lao PDR. During this crucial meeting, Lao Friends Hospital was asked to help write the national training guidelines for all of Laos. A few weeks ago, we welcomed the first group of staff from 9 provinces and Vientiane capital to receive training. The first step in our goal to share our expertise with the entire country.
Last year, the LFHC launched its prevention program. We are working closely together with the communities to combat malnutrition. The program focuses on the first 1,000 days principle.
The first 1,000 days is important since this is the critical period of a child to shape his or her development. Our goal is to improve nutrition and health of children from conception up to the child's second birthday. This dramatically improves babies' chances for survival, physical growth, and cognitive development. Our mission is to ensure a healthy mom means a healthy baby.
Here we are in the inpatient care unit where we take care of a variety of patients, including severe malnutrition. Through the dedication of our staff and competent care and compassionate care, we save many lives. Our prevention team goes out to the community and provides care to mothers and children, including growth monitoring to prevent stunting and wasting, and hopefully to prevent patients from requiring admission to an acute hospital. Thank you very much for your support.
When I see this girl, it seems to be a similar age of my daughter Yoko, and also the girl who passed away in Cambodia is nearly 30 years ago. And I'm so happy. So this girl is here and can be treated, and I know she'll be okay. That's nice that we have a hospital
operating correctly.